Welcome to Healing in Motion, a podcast brought to you by Healing Solutions Physical Therapy. I'm Dr. Julie Booth, owner and physical therapist.
And I'm Ashley Hayden, master massage therapist. So today we are going to get right into talking and discussing about no pain, no gain, kind of what it means to us, debunking some things, talking about some truths, some differences. But also I kind of just wanted to start with letting you know that there are times during the week, multiple times a week, where I see people come in for massage and they say that they don't even know where pain came from. They feel like it came out of nowhere. It just started, which we all know pain doesn't come out of nowhere. Something happened, even if it's something small. So a lot of times we do start sessions slow. We talk about what their job is, what do they do for work? Because sometimes your posture, your position, what you do, the repetitive motion all day can really lead to some of those discrepancies and pain. Or sometimes it's as simple as when we massage that muscle, their memory will kick in and they start thinking about, wow, I really did do this small one little thing different to this time, or got hurt, or I was uncomfortable. And then all of a sudden it just kind of triggers that memory of, oh, this is where that came from. So on the PT side,
Most injuries that I see, they're not from this big accident that just happened.
right.
Typically, it's from small little warning signs that have been ignored. And so then these small little warning signs are starting to accumulate, and people are pushing through whatever those warning signs are because they're not aware of the warning signs. And so that's usually when many times you're reactive instead of proactive. If you're aware of the warning signs, you can be a little bit more proactive in the situation and completely avoid injury from happening altogether. And so that's why you'll commonly hear physical therapists say that they are big into injury prevention. That's where that comes from, is education. Teaching and educating patients what to look for, what type of warning signs to be aware of, so you can be proactive instead of reactive and avoid injury from happening altogether.
Absolutely, because I feel like when we ignore those red flags, then we get into overtraining. Past those red flags, chronic inflammation can come from ignoring those little pains, as well as burnout.
Oh, absolutely. And so the no pain, no gain, I'm just even going to take it back to that talking point. That was something I was taught over 20 years ago. And so, I was literally trained on, okay, if in the rehab setting, I should clarify, PT world, if someone is experiencing pain, okay, we are getting somewhere. We are doing something. Let's keep it up and just kind of coach that patient along. Hey, you're doing well. Still do that. However, it was a very, very uncomfortable setting for them. Who wants to come to physical therapy knowing that I'm going to be in pain today? Do not sign me up on that. You said, did you raise your hand?
Right. Yeah, I'm here for it. My body is here for that. Sign me up.
Sign me up. And so, it was one of those things where it took a while for me to get out of that rut and thinking that way, because I was literally trained to think that way.
There was a thing, it got really big in the fitness world too in the 80s. It was very big on no pain, no gain. For bodybuilders, for people working out, they thought, oh, I am gaining muscle because I am in pain. Even in the military setting, just from experiences from myself, one of the favorite phrases that they used to say is pain is weakness leaving the body. That was like one of their favorite things to say.
They make you say it out loud?
No.
No. While you're working out? That was good. Oh my gosh.
No, they gave us a little break there.
Okay, that was a little kind of them. That's hilarious. I really do think, though, the no pain, no gain, over the years, I was so passionate about it, but as I started seeing different approaches and different ways to treat patients and get the same outcome, but they were not in pain, like, why not go that direction?
Yes.
And so I feel like, at least in the physical therapy world, a lot of therapists were slow to change that thought process. It makes perfect sense if you're, I hate to say the word condition, but essentially, indirectly, I mean, your brain is smart and it's used to thinking automatic, a certain way. This is the only way.
The repetition, being told and shown this is the way, this is how you do things. It's hard to deviate from that.
It is. It really is. And I feel like in the medical world, it is constantly evolving, but there are certain things that do not always change or are slow to change.
Yes.
And to push back on that can be heavily frowned on.
Yeah.
And so, heaven forbid, have an opinion. So, doing something different. But I say, you know what? Sometimes certain techniques, they may not be explainable, but if you get good results and patients are like, loving it, they're feeling better. Why not incorporate that?
The results explain themselves.
And so the whole no pain, no gain, I call it a myth, at least in the rehab world. There are times that you are going to have pain. Don't get me wrong.
Right,
If you can be in control of how much pain you push somebody and knowing where to pump the brakes so they can recover a little bit faster, and it's not this negative cycle loop where they're constantly chasing the pain. They come see you, their body recovers, it gets flared up, their body recovers, and then they come see you again. They have to start that all over again. Tell me where that makes sense.
Well, and then there's just differences between pain, dull pain from discomfort, from muscles actually growing and you getting the proper rest you're supposed to get.
Right.
Because that's where muscle growth happens.
Right.
Or are we overtraining and now it's a sharp pain?
Right.
It's nerve pain, it's shooting pain, it's radiating pain. There is just such differences between the both. And I think that's why people took the whole no pain, no gain thing overboard. Nobody really explained to them the types of pain that is okay, that comes with discomfort, that comes with building muscle, that comes with releasing pains, releasing knots, releasing tension, versus the pain that is, okay, this is over the edge and too much. I feel like a stabbing pain.
Right.
Yep.
So the stabbing pain, the more sharp pain, nerve-like pain is a great example, because when you have those types of pain and then it only gets worse the next day, and then the next day it's even worse, and then it starts to alter how you move and how you compensate, that is a problem, and that is a red flag.
Muscle discrepancies.
That's exactly right. In the physical therapy world, we call that having essentially a muscle imbalance. And so we see that a lot. Your body's compensating due to pain. It's compensating due to muscle tightness, which you see a lot of, I'm sure, or just decrease in strength. And usually it's not just one or the other. It's usually a combination of all the things. You know, and so that's what we commonly see. And then we have to assess, okay, where is this coming from? What's the root cause? And what's causing the chain to travel up, the pain traveling up, pain traveling down? But something that you brought and talked about with pain, sometimes it's tissue pain, which is what we're mostly talking about, and inflammation, like in the joints and stuff like that. But something we didn't talk about is how your brain perceives pain. And that makes a big difference. There was a TED Talk, and I used to listen to TED Talks all the time. I love them. And in this TED Talk, a gentleman, it was Australian, I believe, he was talking about how he was walking down this pathway every day, and occasionally he would have a branch or a twig just rub along the bottom of his leg, along his calf. Wouldn't think anything of it. His brain did not perceive that as a threat. It was just something he felt occasionally, you know, when walking down this path. One day he was walking down this same sidewalk and he felt the branch, and his brain didn't perceive that as a threat. Again, something else that he had already experienced. Kept walking, and he realized it was a snake bite. So a poisonous snake bite. And so his brain then was altered on perception with pain. And so the next time he walked down the path and a branch rubbed along the leg, what do you think happened?
Of course, he got scared.
He got scared, but also his brain perceived it as pain. And so because of that, he felt the exact same sensation as what he felt when the snake bite had happened, but worse. It was pain due to the body's perception of threat. And so that is just how powerful the brain is. But in reality, it was just a branch. And so that was really just kind of a great story for me as a physical therapist. It was really eye-opening. I was like, okay, it's that sensory input, and your bodies are in protective mode. It's very smart. It wants to protect you. So when tying it all together with the snake story, where the brain is perceiving pain really as a threat, so to speak, it's really the autonomic nervous system that is responding to what the brain is perceiving. So the autonomic nervous system has two branches. And so the two branches are your sympathetic nervous system, and that is more your fight and flight. And then the parasympathetic is that rest, regulate, recover. It happens almost simultaneously, but the autonomic nervous system is responding to the perception of, oh, my brain is perceiving a threat. So therefore, I am going to now kick in the sympathetic nervous system. I'm going to run, I'm going to fight, or I'm going to fight. And so that's how they work together.
your mind, your nervous system, your brain, it protects itself. That's a lot of where I see knots come from. And muscle tension, it's not because of a weak muscle, but it really comes from the body trying to protect an area of your body that it doesn't maybe trust to do certain movement. You'll have a muscle knot there. And sometimes they're hard to get rid of. You can't just get rid of them. They won't go away because the body's trying to protect itself. It doesn't want to go away.
Let's break this down a little bit more. You had
Sure.
mentioned that, you have patients that come in and they're like, yeah, I have hurting here, I have aches here, I have pains here, and you're trying to pinpoint the why. Why do you feel like pain just kind of comes out of nowhere?
And I think that has a lot to do with what we talked about. They didn't really come out of nowhere. Maybe we're just starting to actually feel the effects of them. We ignored those little red flags.
Yeah.
We ignored the little small aches of, hey, when I move my arm this way, it didn't really feel too good, but when I did it again, it was fine. What we talked about, we blow past those. So I think it's just the building blocks and stacking of, I'm going to keep doing this because sometimes it feels like not very great, but sometimes it's fine.
Yeah.
We blow past it, and then now all of a sudden our body wants to protect itself and get protective and say, you won't stop doing this movement. You won't stop putting me in this situation, so I'm going to make you stop.
Oh, well said. I like it.
Yeah, it's going to put up that wall.
Yeah, absolutely. And even more importantly, because you had mentioned that a lot of your patients will talk during massage.
Oh, yeah.
And you're able
Conversation is normal.
Yeah, which I when I think massage, I think, relax, don't talk to me.
Yes,
Thank you.
just leave me alone.
Leave me alone and let
And
my
for
body
some
do its
people,
thing.
that's what their nervous system needs. They need
Yeah.
the quiet, they need the peace, they need
Yeah.
to relax. And then there's those people that if they are quiet, they can't relax.
That's interesting.
Yes.
Okay, so let's share. I'm going
Sure.
to make myself vulnerable. Let's share an experience that you had with me
Sure.
when I was like, okay, I need you to work on upper body,
Yeah.
right in through here, mostly like
Absolutely.
here, but mostly here.
Absolutely. Traps. Yeah.
And what did you see? What was my body's way of explaining that it was tense? Something, by the way, I was not even aware of. I had no idea my body even did this.
Yes. So a lot of what your body did, I had muscle twitches with you that you didn't even feel. I was like, Julie, do you feel your muscles twitching? You just kind of like, no. And sometimes that's a tell for me. I'll massage in an area and I'm really paying attention to the entirety of the area, even surrounding it, because muscle twitches happen and most times clients don't even know. They don't feel it. They
Yes.
don't recognize it. They don't even know it's happening until I say something. And even still, they're, you think if you say something, awareness, they're still like, no, I don't feel that. But it's conversation for me with the body. That's our
Yes.
communication. That's letting me know muscles that are either guarding, because that happens. It's uncomfortable. It doesn't want me to touch there because it knows it's in pain. It
Yeah.
knows that's where it's being protected at.
So do you push through that, or what do you do? Oh,
That's a good question because it's different for every person. And
Yeah.
you really have to listen. If I'm getting constant muscle twitches, I know to maybe ease off of that and maybe work on the other side. Ease some muscles on the other side, make the nervous system feel comfortable with my touch. It also depends on if it's our first session, if it's our 10th session. It depends on where we are in our relationship with massage and client. Because my first and foremost thing is to always make somebody feel the most comfortable as possible. Because if you're not comfortable and I just push and blow past, then there's more guarding. And I'm going to do more damage than good.
that makes perfect sense.
Yep.
I would definitely say on the physical therapy side, when I see muscle spasms or involuntary twitches or anything on those lines, education is key. So for you, it's sometimes productive to explain it, but if they're not, it's not bothering them. You're just like, okay, I'm just going to listen to the body and pay attention to that through the
Kind of
massage.
depends on the session and where it's going. A lot of times I'll do hold. Wherever my thumb is, whatever part of my body I'm using to massage them, I will hold there for a little bit of time until I can feel maybe the muscle melt away a little bit.
I like that.
Just give them some time to sit in it, process it, and be able to let it go.
Absolutely. And something that I think we both do commonly is incorporate, fancy word, diaphragmatic breathing, also known as belly breathing.
I was going to say deep belly breathing.
So I notice, a lot of times when we're guarded and we're tense, when we just actually breathe and provide more oxygen to the muscle,
Yes,
the muscle can finally feel comfortable to relax.
absolutely.
And
Because
get a
then you
little bit
find
more
that
done.
people are holding their breath
Yes.
through the exercise, through the stretch, through the massage, through the pain, through the trigger point, whatever we're doing, whatever either one of us are doing, people will, and you can see it because their shoulders will start slowly coming up to their ears. And so immediately, let me say that. Gosh, I just deep breath, take a deep breath with me. And I do it with my client. I take a deep breath with them so they can feel me do it as well.
That's actually one of the first sessions that I'll do, especially my back, my hip patients, is really focus on the breath. And so at its core, we need to have strong tummy muscles, since we're using fancy words, but we also need to be able to be aware of our breath, able to understand our postural awareness as well. And as we start to get tighter, like you said, we kind of hold the tension here. If you become aware of your breath, just simply aware of your breath, you can see yourself tensing up, and it allows you to be more aware of just your postural awareness as well. And so just sometimes when you're going through a difficult moment, you're stressed, or your natural response is to get angry, frustration, just whatever. So you hear something, you look something, and on your phone, and I mean, that's stressful in general, and you don't even realize you're holding that tension. Just being able to take a moment and do some deep breathing, some belly breathing, can just let things go for you.
Julie, I feel like we should do some belly breathing now.
I think so. Like, what the heck is belly breathing? Let's talk about it. So it's something that I commonly make sure that most patients are aware of when they're doing their belly breathing is I'll have them put their hand on their chest and their hand on their belly. Is my chest moving or is my belly moving? And so when your chest is moving, why is that?
Because we're not getting enough breath actually into the diaphragm where we need it to go. We're breathing with muscles that we don't need to be using while we're breathing.
We're using our accessory muscle.
wrong-
It's muscles that are shallow breath.
Yes.
It's a lot more shallow. And so we're not getting a nice full breath in through the diaphragm. So what you want to do when you breathe in through your nose, you want to push your belly out. And I know that seems so opposite of what you naturally would want to do. And so typically when we start this, I'll have patients lay down on their back, much more natural than initially starting it sitting up. So if you're at home and you want to lay down and join us, feel free to do this. Pay attention to your breath. Put your hand on your chest, put your hand on your belly. And we're going to do a count of 10. One time through. We're going to breathe in through your nose, and you're going to breathe into your belly. You're literally going to have your belly expand out for 4 counts. Exhale through your mouth, and your belly is going to drop back down. So let's go ahead and try that one time through. You're going to breathe in through your nose. 2, 3, 4, and out through your mouth. 5, 6, 7, 8, 9, 10. That's kind of hard to do. Count and breathe at the same time.
You got this. You can do it.
So I'll do it one more time without counting and see what you're feeling at home. Is your chest moving, or is your belly actually fully able to take over and move? Okay. Now, I felt my chest move. So that means I need to relax a little bit more myself.
I did the first time we did it, and I was like, oh, they're going to see my chest is moving.
My chest,
But I mean, it
definitely,
happens, and it's okay.
You just readjust. Don't beat yourself up.
Awareness
is all about awareness. Exactly, Ashley. So just go ahead and do this one more time with me. That felt a lot better. How'd that feel for you? Okay.
It did.
More natural. Even though this is a little unnatural at first, but I will say this. A lot of times, especially my athletes, see this, they want to just go after it. And so they're used to being able to just get the best breath possible. And so even breathing in through your nose and out through your mouth. And so you will compensate to get that best breath because you are expecting something big. Yeah. Sometimes it's just taking a step back and doing a smaller breath, just not expand the belly maybe as much. Don't worry about it. It will come as the body starts to relax. It will naturally come. It'll happen. And so that's just something that, a little trick, if you're feeling like you are even doing a workout or anything like that and you're really guarded, maybe just lower the weights, or maybe just be more aware of your body alignment and how your body is responding. Your body's telling you, hey, maybe this is too much. And so maybe I need to take a step back.
Yes, absolutely. Completely agree. Even if you're at work and you're feeling yourself getting super stressed, instead of getting, like Miss Julie said, frustrated or angry or whatever emotion you feel like you're feeling, take some deep breath, get some clarity, get some oxygen to the brain to get rid of some of that brain fog, and then ease into it. Relax, think about it.
And if we're mindful of our breath, at the end of the day, we're going to be more proactive instead of reactive. And so we can get ahead of the pain, we can get ahead of the tension, and we can just give our body what it needs. And that's sometimes just a minute away from what you're doing, just stepping away and just get that clarity. I really like that.
Who knew it just took some deep belly breathing?
Yeah, I feel a lot better. I even feel more relaxed. We need to start
Right. At the
every
beginning
session.
of every session, belly breathing.
Belly breathing's where it's at. There we go. So a recap, if you want to perform better, breathe better. That's one. Just self-awareness. Just be more mindful of your everyday movements and just how you're not only moving, but breathing. Are you getting tense when you're doing certain things? What do you do when you're feeling tense? Just maybe take yourself away from whatever you're working on and walk away. Maybe, we're constantly staring at a screen.
Yes.
Or phone.
Yes.
And what does that do to your nervous system? That just puts it on high alert all day long.
Constantly.
Constant. And so your body can't move better and feel better if it's on constant high alert. So just taking a break, maybe every hour, go walk 3 to 5 minutes, just move a little bit more and give your eyes and your nervous system a little bit of a break.
Because remember, your body will whisper to you before it starts screaming. So listen to the whispers, little details, which can't come until you are in a relaxed. You can't be aware until you're doing those deep belly breathing. So in order for us to even hear those whispers, we have to be able to calm down and relax in our lives. So all in all, it is not about no pain, no gain, because when you're in that state of no pain, no gain, you can't listen to your body.
Nope. It's
Not
on
properly.
high alert. Nope, not properly. You can't go to the next level, even more importantly. You
Absolutely.
know? And it just is what it is. So at the end of the day, your body is always communicating to you. So your job is to be able to understand what it is saying to you so you can respond to it better, so you can reset, you can rebuild, and you can reclaim what matters most to you.
So if you're ready to move better and feel better, go ahead and like and subscribe to this channel. And please share it with anybody who you feel needs to move better and feel better. So that way you do not miss the next episode of Healing in Motion.